that shows a black woman diagnosed with breast cancer today in Georgia is 45% more likely to die from the disease than a white woman or any other. And some say this disparity means that mothers, wives, and sisters are making a very deadly choice.
When you tell people you have breast cancer, the look on their face change. It's a look that you're going to die.
After losing 3 aunts, a cousin, and her mother to breast cancer, Felicia Mahone learned the lump in her chest was the most aggressive form of breast cancer, triple negative. She was 27 years old and uninsured. Mahone says the women in her family were silent about a disease that killed so many of them.
It's something that is common around African American women.
And why?
I don't know. I think it's a sense of shame that people feel.
For 3.5 decades, breast cancer rates have dropped by almost 40% in this country, but not all women benefit equally.
The risk of death of breast cancer is much higher in black women than white women.
Carol DeSantis is an epidemiologist with the American Cancer Society. Her research reveals a disparity in who survives a breast cancer diagnosis.
Overall in the U.S., breast cancer death rates were 42% higher in black women than white women. Here in Georgia, they're 45% higher.
According to DeSantis's research, black women are getting mammograms and learning they have the disease, but some don't seek treatment. American Cancer Society Chief Medical Officer Dr. Otis Brawley says women often delay treatment because of financial hardship.
Sometimes it's I can't afford to pay to see the doctor. Sometimes it's simply I have a job and I can't take time off from my job.
After fighting for care and even losing her job to get her treatment, Mahone is now a patient advocate at Grady Hospital, supporting other women who have trouble accessing care. She told me about one of those patients.
She was diagnosed with breast cancer. So the next step was surgery and chemo. And she said she couldn't do that because it didn't fit into her schedule. Because if she didn't go to work, her kids wouldn't eat. And I said, if you don't go back and you allow this to manifest, your kids are not going to eat. They're not going to have a place to live because they're not going to have a mother.
I can't imagine having to make that choice. Dr. Brawley says delayed treatment means a long, painful disease that could be prevented.
We see people who actually know they have breast cancer, know they have a problem, watch it grow for a long, long time, and then ultimately they come to us when it's a disease that we can't really treat very effectively.
Mahone says she hopes women will fight for treatment because so much pain and loss is preventable.
If we would love ourselves as much as we love our children, then, oh my God, you know, the disparities that we have with this thing, with this breast cancer, with African American women, it will go away.